What's up, YouTube? It's Logan. This is going to be my 6 months on T and 2 months post-top surgery video. So I'll just, to keep this one short, I'll just sorry about that. I'll just jump right in. Changes on T, 6 months. My voice has dropped pretty significantly over the last month. I also had a comment from someone. I discussed in my last video about how I wasn't passing very well. And I got a comment from someone who told me that that it was possibly because of my hair. The way my haircut was, because it was kind of rounding my face out a little bit, making me look more feminine. So I took his advice and I got my hair cut. I tried to keep it really short on the sides, to kind of square out my face. And kept it longer at the top because that's, I like it like this. And that actually has done a good deal for me passing. I am passing at, my patients are reading me as male, maybe one or two out of 10 interactions with patients, they read me as male. If they go with male pronouns, I don't correct them. If they go with female pronouns, I don't correct them. So I'm not really to a place yet where I feel comfortable enough existing in a male space that if I tell people that I'm male, that they'll not feel uncomfortable with that, and trying to kind of looking at me like, are you sure? And funny enough, like, it's just, I feel like my voice is to a point where, people should be reading me as male, but I know that I still have some feminine features, and I do kind of carry myself sometimes in a pretty feminine way, and maybe that's affecting how much I pass. But at this point, like, I don't really, passing is not a big deal. I'm more, focused on just trying to work through coming out at work. I've told a lot more people, and actually people have said something to me, not negatively, but have mentioned to me about my transition, and it's people that I haven't told personally. So obviously it's getting around, but I haven't had any negative reactions yet, which is good. So, and people, I actually did have one nurse, a male nurse that I work with. He's a little older. He's an older guy. With a patient, I was getting a report from him, and I went in the room to meet the patient. And he said, this is Logan, and he'll be taking over for me, and he'll be your nurse. And I really appreciated him because that was completely unsolicited. I did not ask him to do that. And then he told me that when I walked out of the room, the patient asked him if I was male or female, and he said that's a guy, that's a man. And I really, that was such a huge deal for me because I really appreciated this guy, went out of his way to make me feel comfortable, and he addressed me with the right pronouns, and he was just really, without me even asking him to do this, he took it upon himself to, tell people that I'm male. So that was a huge deal. So things at work, they just are. But everything else, I'm passing okay, I guess. I mean, or what I expect to be passing at this point. But as far as changes go, again, my voice. But the biggest thing that's been happening is just body hair. Like, I am so hairy now. Like, I have hair crawling up my chest. I have like hair coming up here, and I actually am starting to get a little bit of hair coming in on the sides here. I have, some peach fuzz coming in right here that I didn't have before. Not so much here, mostly on the sides. I have some hairs that are dark. I haven't shaved my face yet. I don't know that I will for a while. And actually, if anyone could give me input on whether or not that shaving, like, if I shave my face, will the hair come back and grow darker than it was originally? Like, like this part that's getting long, but it's still blonde, like, will it come back dark? I don't know. I don't really know how that works. But I hear that shaving is something that people, once they have to start doing it, they're like, man, I wish I didn't have to do this. But I'm looking forward to it, personally. So, hair. I mean, I didn't think that I was going to be a hairy person, but my legs are very hairy. My thighs, you know, my everything. It's all connecting. I looked at a picture of my stomach from 3 months on T, and I was like, oh my god, like, wow, I didn't realize how much hair I have now. Also, I don't know if I mentioned in my last video, I was having some issues with acne. Like, my acne was getting really bad, and I had upped my dose around like 3.5 months on T. I upped my dose to 100 milligrams weekly. I do take my shots weekly. I started at 50, and I am now I moved to 100. And then I had like a week or two where I didn't take my testosterone because I was having surgery. And so in June, I was doing 100 milligrams weekly. And during that like 3 or 4 week period, my acne just went crazy. Mostly on my back. I mean, my back and shoulders are like covered in acne. And I was also having a lot of emotional lability and just feeling aggressive and like I don't know. So I sent a message to my endocrinologist and I said, you know, this is what's going on, and I asked her if she thinks that I should lower my dose. And the way that my endocrinologist bases her dosing, she tailors it to the individual. You know, she tries people out at 50 milligrams starting, gives it 3 months, and then he says that that they can increase it. And so I was at 100 milligrams weekly, which is 200 milligrams every 2 weeks total. Which is the standard dose. That's the highest, you know, male replacement dose. And so I asked her if she thinks that I should move to 75 milligrams weekly and see how I do on that. And she said, you know, I'm the only person that can really determine what the best dose is for me, and that, you know, it's fine to decrease it, and to see how I do. So I went ahead and, I guess about 3 weeks ago, I went ahead and started on 75 milligrams weekly. It has been more tolerable. My acne has slowed down a lot. It's not as bad as it was before. Sorry, it's getting dark. I'm outside, and I don't know if people are going to be able to see me. So yeah, so I'm at 75 milligrams, and so far it's been better for me personally. I still have not had shark week, I guess, for lack of a better word, since starting testosterone. So I know that as far as replacement goes, you know, they usually go based on, you know, if the dose is too low, you start menstruating again, and that's too low. And that's not happened, so I guess I'm okay. Anyway, that's enough about T changes. You know, things are just keeping steady especially with hair growth. So I'll go into my scars before it gets too dark. So let me sit on my feet so you can see. Alright. So let me take these off. These are my scar strips that I've mentioned before. And I'm still doing the same scar routine that I was doing before, where I use cocoa butter on my incisions in the shower, and then I wear these strips pretty much 24/7, and I change them about every week. So it's a little bit inflamed because the adhesive kind of irritates my skin a little bit, but let me see if I can get closer. So this is what I'm looking like 2 months post-top surgery. This is the left side. This is the right side. You can still see, I'll let it focus a little bit, sorry about that. There we go. You can still see where the sutures are inside. And again, this looks more irritated because of the steri strip. I mean, not steri strips, scar strips. But, my scars are almost completely flat, and they're starting to fade. It usually takes about 3 months for your chest to look close to how it's going to look. Ultimately, they say don't judge your chest until 3 months. So the scars are definitely looking better. I have had some stretching right here on the right side and here on the left side. I think it's because when I sleep like this, and it pulls. And I still have a little bit of a indentation here, but it's actually flattened out a good bit. But I have full range of motion. I can pretty much do anything. I haven't started lifting weights just because I don't have a gym membership right now. But I plan on getting one soon. But yeah, I feel really good about it. And it's looking better and better every day. Anyway, obviously this camera's not going to focus anymore because of the darkness, so I'm going to go. But if you have any questions, again, I'll link my Tumblrs down below, and I'll be doing a update on my picture update on my chest on my transition blog sometime soon for 2 months. Anyway, see y'all in a month.